Hi, this is Mrs. Lewicki, and I'm talking about this is part two of prioritizing care. In the previous PowerPoint, we talked about the nursing process and Maslow, and we're going to talk in this one about a few other things. One of them is time constraints. Sometimes one of those is deadlines. Deadlines are things like you have to get the patient to the operating room or for a specific procedure. You need to get the patient discharged because another patient is coming from the operating room. Those kind of things. Other things include administration of scheduled medications, and I talked about that in the previous slide about when insulin has to be given or that we have a certain amount of time to administer medications. Planning to do things at expected times to avoid potential negative consequences for clients. That includes things like making sure that I give them pain medication in enough time before I do their dressing change or before their activity, things like that. Urgency factor, sometimes time priority, how much time can safely elapse without compromising client outcomes. Urgency are how urgent is this as a priority list? Is it acute? Mean if I don't do something now, the patient is going to quickly deteriorate, or is it non-acute? Is it critical? Critical is worse than acute. Is imminent death going to happen if I don't intervene now? Is the patient going to die if I don't do something right this minute? And that changes your entire plan. Ranking activity, priority 1 or must do, 2 should do but not essential, 3 is nice to do but only if I'm able to do 1 and 2. Triage, identify priorities for implementing care. So again, is it emergent or immediate or life-threatening, urgent or delayed? So serious conditions where delay would not result in life-threatening situation. Non-urgent or minor, patient can ambulate if stable. Um, they're not going to die if I don't take care of it. They're not going to lose their limb if I don't see them in the next little while. Factors to consider, most important interventions get done, lesser priority activities may get done, and least important activities may not get done at all. Principles of justice and fairness apply when I'm trying to decide that. Difference among clients is urgency of needs. There is no other difference. How urgent is their need? Life-threatening problems are priority over psychosocial problems. Safety includes doing no harm. Environment supports quality care. And medications, we want to make sure that it is a high priority that we want to administer medications safely. And that includes sometimes having a quiet zone around where you're administering medications so that you can collect them and concentrate on that. You want to always consider your availability of resources, and those are things that help nurses meet client needs. Those are human resources like your UAP, your unit secretary, maybe your charge nurse, maybe physical therapy, maybe respiratory therapy. And sometimes there are physical resources like adequate supply of dressings, a blood pressure cuff that works. And we want to ration based on our priority. And sometimes it does involve creativity and resourcefulness. There isn't an IV pump for every patient in the hospital, and so we have to ration those sometimes. Sometimes if there's a trauma, a massive trauma, we have to ration the blood supply. So where is my hemoglobin? Which patients are my priority? Things like that.